Knee pain is a leading problem across the globe. But what about the treatment options? Multiple, right? But what about the right treatment choice? Our next talk is by Dr. Rozil Gandhi on the latest treatment approach for the knee joint. He is an interventional radiologist and has done first case of genicular artery embolization in India, which is non-invasive procedure for treating knee. He has experience of more than 500 embolization procedures, and I would like to invite him on the dais.
Thank you, Isha, for the introduction. Good morning, everybody. We'll talk about genicular artery embolization. As we all know that knee pain is the leading cause of morbidity in old age patients, and with the average age increasing across the globe, this has an important role to play. The spectrum of knee pain starts with the treatment spectrum starts with conservative management, that is NSAIDs, pain, basically, that is, they are called the pain tablets. Then comes physiotherapy. But what after physiotherapy? If there is still pain, patients generally prefer to go for the knee replacement. But there is concern about the surgery and the replacement. So we have introduced genicular artery embolization in between the physiotherapy and the surgical part. Genicular artery embolization is a minimally invasive angiographic technique whereby we embolize the inflammatory vessels that supplies the knee joint and relieves the pain. What is interventional radiology? It encompasses many sub-branches of medicine. So we have minimally invasive treatment for more or less every subspecialty in the medicine. Today we have talked, and Dr. Mohal has also talked about the Japanese technique. So what is this, the Japanese technique? Embolization means closing of any vessel, whether it is an artery or a vein. We used to occlude or embolize the tumors. We embolize the bleeding vessels. We embolize the varicose veins. Japanese started embolizing the inflammation in 2010 and 11. They published the first paper in 2014 by Dr. 𝘂𝙚𝙗𝙪𝙡𝙗𝙡. So embolization, the treatment of inflammation by embolization, is a newer thing. Embolization itself is not new. So we embolize the osteoarthritis of the knee joint, we embolize the plantar fasciitis, we embolize tennis elbow and frozen shoulder. And by embolizing, we help in relieving the pain. This is just a schematic diagram of the knee joint showing the various ligaments and the tibia and the femur. First important thing when a patient of knee pain comes to us is an examination. Clinical examination is very important. The pattern of pain is very important. As Dr. Abhilasha mentioned, whether the patient has a rest pain, night pain, tenderness is very important. Which part of the knee joint has tenderness, that is also very important. Examination is generally done by, after that we do an X-ray, and if needed, MRI of the knee joint is done. KL score of X-ray, it is very important for grading of the osteoarthritis. Some treatments are done in the early osteoarthritis, some treatments are done for the late osteoarthritis. As I mentioned, MRI and X-rays are very important. Angiographic image of the arteries supplying the knee joint. So there are 6 arteries that supply the knee joint. The cranial, it is the descending genicular artery. Then comes the superior lateral and the supromedial genicular artery. Afterwards, it is the infromedial and the infrolateral genicular arteries, and then there is recurrent genicular artery. We during the angiographic procedure of embolization, we cannulate each and every genicular artery. We do a detailed evaluation, and if there is any inflammation, if there is any hypervascularity, we embolize it. After proper evaluation, and if there is correlation between the tenderness and the osteoarthritis, if the osteoarthritis is early and moderate, like grade 2 and 3, we take the patient for a genicular artery embolization for knee pain. We take femoral arterial excess, that is in the groin. under ultrasound and fluoro guided with a 4 French sheath. 4 French sheath is 1.3 millimeter in diameter. So this sheath insertion is done under local anesthesia. The entire procedure is done under local anesthesia, where patient can see the entire procedure on the screen, and there is no need of suture or anything else or general anesthesia, because the incision is just 1.3 millimeter. So it's just a needle prick. Coming to a case, 58-year-old female had bilateral knee pain and right heel pain since 1.5 years, severely restricting her daily activities. Some areas were more tender. Basically, the medial knee joint space is the weight bearing area, and it is affected more. So generally the patients tend to have tenderness medially. This patient was diagnosed with knee osteoarthritis and plantar fasciitis. Now, what is the objective part of evaluation? WOMAC score. So there are points and the marks given to the entire score. So in this, we evaluate when the patient has pain on walking, on standing, on climbing stairs or climbing downstairs, on sitting to standing. So there, this is a good scoring system. That is the international scoring system, WOMAC score. Radiograph is done and an MRI is done. So this was a grade 3 osteoarthritis with osteophytes are also seen medially. The joint space is more reduced on the medial compartment. This is the WOMAC score by which we evaluate every patient. This is also helpful for post embolization follow-up. We can see how much score has reduced, and thus it helps in objective evaluation of pain relief. So every patient, before going to knee replacement, or every patient of knee pain should be given an option of embolization after failed conservative management. Failed conservative management is failed management of oral medicines and physiotherapy for after at least 3 months. Earliest ambulation after 6 hours. After patient has underwent genicular artery embolization, patient can ambulate after 6 hours and do his routine daily activities. This is an angiographic picture. This is a descending genicular artery, and this is our microcatheter, that is 2 French. 2 French is less than 1 millimeter. This is our microcatheter in the descending genicular artery, and this is the normal artery, and this is the hypervascular blush. This is the inflamed area. Inflamed area is generally synovitis, is a generally synovial inflammation. That is because of the neoangiogenesis. What is neoangiogenesis? This is that they are abnormal vessels supplying the inflamed part. What does abnormal vessels do? They create neurogenesis also, and thus cause pain. So the root cause of osteoarthritis is not just wear and tear, it is also chronic inflammation. So we embolize the chronic inflammation, we embolize the hypervascularity, and thus by reducing the angiogenesis, the pain relief starts. This is infralateral genicular artery. As I mentioned earlier, we go in each and every artery super selectively and embolize the blush. This is again blush in the inframedial genicular artery. This is supralateral. This is the angiographic image of the artery of the lower thigh, that is the distal superficial femoral artery and the popliteal artery. So this is how the angiographic images look. These are all various images of the genicular arteries after and before the embolization. Japanese term the hypervascularity as moya moya. They are the abnormal vessels supplying the inflamed synovium. So there are many people who ask me whether after embolization there would be necrosis. I mean the joint would become dead or not. So no, nothing happens like that sort of. After we only embolize the hypervascularity, the parent artery or the original artery remains open. So there is no necrosis, or the knee joint is not dead. As I mentioned, procedure is done under local anesthesia. It is a pinhole technique. We are just puncturing with a needle, and the incision site is just 1.3 millimeter. As it is pinhole technique, the complications are minimal. Every procedure has its complications, but this is very minimal with genicular artery embolization in a range of less than 1%. Immobilization up to 4 to 6 hours. Patient generally feels complete pain relief from the next day, but the complete relief occurs up to 6 weeks. They can start with normal routine activities, light exercise from the next day. So our experience is now of more than 500 patients with grade 2 and grade 4 osteoarthritis. 25 patients with various reasons had recurrence of symptoms, and we did repeat embolizations in some, and they have good relief. First patient was done in September 2020. Uh, our our study of plantar fasciitis is already on the route to publish, and we are going compiling the data on this also, and we'll publish this soon. There are many people do feel, and we are doing a experimental therapy. So it is not an experimental therapy. There are various papers in various international reputed journals with good impact factor, and various papers are published right from 2014. This is published in European journal SIRVA about medial osteoarthritis and importance of embolization. This is an paper from US saying the same thing, that genicular artery embolization can be used to treat pain secondary to osteoarthritis, and it demonstrates efficacy. Which patients are suitable? Again, this is a Japanese paper showing that patients with tenderness and medial joint pain are more suitable. This is a study with 2-year follow-up, again by the Japanese. It is showing embolization is a good treatment option for patients with lateral knee pain also. So how it works? Hypervascularity of the synovium, it irritates the nerve fibers, nociception, and they are the source of nociception, and thus it causes pain. So by reducing the vascularity, we stop this. This is a mid-term follow-up and MR imaging after embolization showing no knee joint necrosis, and just the synovitis that is reduced, but the knee joint remains the normal. So it is like magic. That is our branch, intervention radiology. And one of the patients follow-up who had undergone knee pain, embolization.
Hello everyone, I'm Anuja. I live in Chicago, Illinois. Since last 2 years, I was having intense pain on my left knee and bottom of my left foot. That was affecting my day-to-day life. I was not able to keep up with my daily activities. Every morning when I wake up, first few steps were very painful for me. Then we got to know about this non-surgical Japanese procedure, genicular artery embolism. So we decided our trip to India, and we met with Dr. Mohal Banker and Rozil Gandhi. They were very friendly, very helpful. They explained the procedure, and we decided to undergo the procedure. The procedure was very easy. The recovery period was very short. I was back from the hospital the next day. Recovery was not as painful as I thought it would be. I was able, during the procedure, I was able to see the images and the ongoing procedure on the screen all the time. The staff was very friendly. This procedure worked like magic in my life. I am back to being normal. I am able to exercise every day. I'm able to keep up with my daily routines, and no pain, no pain. This was a magic in my life. I recommend this procedure to anyone who's suffering from the pain, and it will work like magic in your life. Thank you.
Thank you.